issues where they've gotten a person infected with COVID-19. What has it been like amongst the community? Have you gotten amongst the people living with HIV at any one point, any of them who's gotten COVID-19?
Yes, indeed, there are some, but of course, again, there is a stigma associated with this disease. When people tell you after they have cured. We have lost a few people, and of course, they don't tell you they died of AIDS, but we have lost a few of some of our friends who were HIV positive, but they got COVID. So of course, COVID is the new kid on the block. It's what is reported. They report COVID, but we know that this. By the way, on a personal level, myself, I got COVID.
Oh dear.
I got infected with COVID around December. In December, we have a lot of activities around World AIDS Day, you know, the first day of December. So though I was supposed to be at home most of the time, I moved around, because you know they had opened a bit. And during that time, I remember moving sometimes in taxis, because, you know, you have to move here and then rush this way. Sometimes on borders, because, you know, you get stuck in the middle of the car, and you have to jump out of a car. So I got infected with COVID, and for about 10 days, things were not good. Eventually, by God's grace, I survived. And one of the things that helped me is, I think, because although I'm HIV positive, my immune system is fairly good. My viral load is suppressed because I take my medication well. So I did not suffer worse than any other person who is not HIV positive. And this is the point, is that if you're HIV positive and your immune system is strong, I call it the personal protection unit, your CD4s are high and your viral load is down, it means you can be able to withstand these things. Of course, there are the underlying conditions. For example, if you are diabetic, you have or hypertensive, or have cancer, or any other illness, certainly that is what has caused problems. Many people who die are those with those conditions. And of course, even people living with HIV who are not taking their medication well, and their viral load is not suppressed.
How easy was it? Is it a situation like when you say you got COVID around December, in addition to the way you are living? Did you open up to people about it at the time you got it? Because the truth is, like you said, many people talk about it after they have cured.
Tell you the truth, I was scared. I've had a near-death experience in 1999. I had AIDS. I had TB, very bad form of TB called MDR. I had cancer, and I had meningitis, all at the same time, and I almost died. This time I thought, okay, this is it. But being, of course, I'm 68, I was 67 then, I said, well, not bad, I've had my time really. But of course I was scared. But for me, because of my position as a leader, and I think a leader should take risks, I posted on all WhatsApp groups I am on that, look, I am infected with HIV. I mean, with COVID.
With COVID now.
What surprised me is that very few people commented on the what?
On the post.
On the post. Or most who responded inboxed me. Say, why are you doing this? Say, but look, I thought I needed support. What is working somewhere? And I believe in prayer, so you pray for me. And if there's something that you think I can do, encourage me. But many people have said, wow, this is not normal. They feared the stigma associated with the disease. But I think because of that, people prayed for me, of course, but I also did what was known to be working at that time, took a lot of ginger, took a lot of lemon. Actually, I took even ivermectin, because we have ever used it. I didn't know whether it would work because we have never used it, but since it wouldn't hurt me, I used it and put on prayer. I recovered. But most of the people who got COVID recovered, by the way. World over 90% of the people, I think, recover. The problem is many die and they hype, and the media picks on this. And for me, I kept saying this, that it's good we keep an eye on HIV, because, you know, we lose over 50 people in Uganda daily to AIDS-related causes. So I told them, no. If people who are like me, who are HIV positive, did the right thing, even if they got infected, they are not in a worse position than any other person, so long as they don't have an underlying condition like diabetes or high blood pressure. So that's why I did that. I know a few other colleagues who also posted that they've tested positive. Most people didn't fall sick, by the way, never had symptoms, although they tested positive. But of course, the majority of people who have tested, who got COVID in Uganda, kept quiet.
True.
We respect them, but of course, the fear, and the fear is based on actually myths and misconceptions about disease. We have seen this in the HIV.
Wow,
So some of us chose the way of demystifying it by bringing out this information in public domain and helping whoever can. Of course, we have made mistakes, myself inclusive. But without making mistakes, how shall we learn? Some mistakes could be costly, but it's okay to document them so that you don't make the same mistake in the future.
Very true. Yeah. Now, when we get to the issue of one of the challenges I know was poor drug adherence. Much as you have created the system and communicated on how they could be able to get access to the treatment without defaulting.
Yeah,
how have you helped them to ensure that they adhere? Because
adherence is very important, meaning taking your medicines at the right time and the right doses, that's agreed. Now, of course, there are factors. Okay, knowledge like what I'm telling you is important, but also the social conditions. For example, if there is stigma, or because of the lockdown, for example, I'm thinking about a lady, and this is a true story, who was doing very well on ARVs. Her husband is a long-distance truck driver, comes around once in a while, and they are married, you know, understand. But now he's stuck at home because business was going to Sudan, business was not there. So he parked the road and sat at home most of the time. This lady could not swallow her medicine well. She had food, she had the medicine, but because the man is around, you fear going to swallow the medicine because you have not disclosed. So this is a problem, lack of disclosure. We have also seen the issue of food. Most of people, for example, in Kampala or urban areas, Merialero, you go out, you work, and it works. Every day you go out, you come back with food, and everything is okay. They both put a lockdown, you can't get food, and you must swallow medicine. The issue of gender-based violence also has increased. We have noticed this. Women battered. You know, some of the things quite annoying. You know, sexually forced into sexual acts. We have seen, of course, you know, I'm sure you've covered the issue of teenage pregnancies. Oh, these girls shouldn't be pregnant. They should be at school. But in some disciplines, we've had up to 100 children impregnated. Now, that means over maybe 200 were involved in sex, because not every sexual act ends up in pregnancy. So these are some of the issues that the COVID epidemic has the effect on HIV. Yeah. And maybe the real results are going to come in the future, because we mentioned 100 children defiled, in a way, if I may use that word, and impregnated. How many of those got HIV? We don't know.
Now, you as us as adults, I should say, have a particular level of control and in issues of decision making. How has it been amongst the people living with HIV who have, especially like the teenagers and the youth in that area and bracket and category? How have you helped to manage and to support? Again,
of course, teenage years are very turbulent years. And we have seen, even without lockdown, teenagers, we reach a point they ask why. They ask these questions, why sit down, why swallow eat your food, why do this? So it is a challenge. And then many of them, of course, were being helped because we have support groups. Support groups, if you go to places like in Mulago, they have very good support, strong support groups for children, adolescents. Now they cannot go. They cannot go. I know the internet is there, but not many of our people have access to telephone or smartphones and so on. So this is a problem. I don't have figures, but your guess is as good as mine. Surely, if you do not have, of course, we have sorted the issue of ARVs. You said, no, you can get ARVs from a nearby center, even if you food. Okay, we can do that one, but they must have counseling. Now, counseling means being able to interface with the person. You can do it on phone, yes, but how effective can you be? We need to be able to empathize with this person, establish rapport with them, and support them and help them in their way, their challenges. Many of them are also struggling with their coming of age, with their sexuality, and so on and so forth. So these are some of the services that are not readily available during lockdown. And therefore, we argued, and I remember personally, on a personal level, I argued I remember sending messages to the COVID task force that on the task forces, you must include there people living with HIV. First and foremost, this is a virus, and we have seen We have learned a few lessons through making mistakes, but also doing certain things. We brought down, for example, the prevalence of HIV in the 80s from 18% to the current 6%. We brought down infections among its children from 25,000, I think, around 2011, to less than 3,000 now. So surely there must be something right we're doing. Can't we use some of this information to deal with COVID? Of course, the response has been a bit varied, but I think we're getting there. People are seeing that we can learn from, you see, we learned from Ebola and HIV, and we can manage this new virus. It has a lot of challenges. The infections are different. The infection methods are different. But it has to do with behavior. For example, we have the way we used to teach people how to use condoms always. Yeah, it's the same thing. People use your masks. When you go in the taxi, you see how many masks are below the nose, others are below the chin, others are hanging on the ear, others are not anywhere at all. And yet people are busy talking. We tell people you must use condoms each time you have sex. If it is not on, it is not safe. I think the same message can work with COVID. If the mask is not on, you are not safe.
I totally agree with you, Dr. Watiti. Now, in terms of like the support that you have been doing as a Nafufano, like, tell me about the process. How did you manage to, and where did you get from actually the food that you were taking to the communities out there? How easy was it? Did you cater for what percentage and in what areas? You said first, you said Karamoja, that one, yes.
Karamoja, yes. Of course, in the village, like this, we can't say we did much because in the village, people were not even getting, they know how, and the lockdown didn't affect them much. But in Kampala here, it has been tough. Many people, I don't want to tell, but people call you. I am not. If I showed you some of the messages on my phone, I'm supposed to follow medicine. There is no money. I've just sold medicine. Can't you send me even 1,000 I buy a banana? So we did. We have tried to raise this. The problem, though, of course, is the stigma. Some people keep quiet. But even with those, we try to say, look, even if you are not able to talk openly like Dr. Watiti and others, call so-and-so. And these ones, especially our friends, especially who have double stigma, like the sex workers, there are many in Kampala and other urban areas. They must eat every day. They must swallow their medicine every day. But they can't go and do sex work. We encourage them not to do it, of course, for their own safety and safety of all of us. Then there are the MSM, people, the men who have sex with men. Again, they cannot, like any other, they can't do work, and yet they are on ARVs. So these are part of our groups. We did. We raised noise. One of our areas is advocacy. And luckily people came in. We have had some support from UNAIDS. We got support, I think Nafano recently told me they have got support from the Aga Khan Foundation. They're going to take food in Arua, some food items. We even argued for cash transfers. I think I remember talking to Tasso, we did, and they raised some money. Took a bit of time, like the Honorable Minister, Prime Minister did. We sent some money. Some people received some money, not many. The idea was, if we know you are needing help, it is our pain. Of course, not most of the Ugandans who have HIV are not registered in these organizations. And they suffer quietly. But if you are registered with us, not because of this, but it's good to register when there is no trouble. Belong to a support group. One of the people I admire most is a friend of mine called Reverend Canon Professor Gideon Byamgisha. Yes. Now Gideon Byamgisha, I knew him when I was at university. Young man, he was a younger man because he's younger than me, but he's an older man, of course, and my senior more or less in many things. But when he fell sick, he came up with, he calls Friends of Canon Gideon Byamgisha. And they're all over, from all over the world. Now, I would suggest that every person living with HIV, the over 1.4 million Ugandans who have this disease, I wish you could form a network friends of Stephen Watiti, friends of Sophie, friends of, name it. Let's have friends, because you never know when you need them. Yeah, social capital is very, very important. We have seen people have a lot of money, but money couldn't help them.
No, it couldn't.
In fact, what has helped most of us during this lockdown is social capital. And this is what we have tried to cultivate along the way. The National Forum for Living with HIV, telling people that the biggest asset we have, the biggest resource we have is ourselves. Let us invest in relationships so that we are able to call. During one of the challenges during this lockdown is depression.
Oh, yes.
Depression. People locked up, you are depressed. And you have nobody to call. Yesterday I visited a friend of mine and he said, thank you. People don't visit during this time. He was sick. He said, I can't believe this. He's a big man, but lonely and depressed. Alone, like Philip Bongole put it, alone and scared.
And frightened. Yeah, true.
Alone and frightened. We can avoid this. But the time to build this is during the normal time. You do not start building a boat when it is already raining.
Now,
you build during the dry season.
During this period of time, amidst the period of COVID-19, have you had numbers increase amongst the people living with HIV? And also, secondly, how do you guys, or how have you been able to have that solid database from the different networks under NAFOFAMA?
Well, we do not have solid statistics to show that. Maybe the infections have gone up, but we can imagine if children are being impregnated.
Oh, yes.
Surely there must be, because that means they had unprotected sex. Of course, before the lockdown, the statistics were saying that there were about 1,000 new infections every week, mainly adolescent girls and young women. And you know why. These are the ones who are sexually active most of the time. So we believe that this is going to, first and foremost, counseling and testing services are not widely available. If somebody is raped, the access to PrEP, PrEP means you are exposed, or maybe not even raped, or maybe a relationship goes bad, or you find yourself in a compromising position, you cannot get this medicine to prevent possible infection.
Yeah, true.
Even PrEP, you are in a discordant relationship, but you don't have access. Or counseling services, you need to say, I don't know what to do. So this is because we had very good counselors. You could walk in and you get counsel, go to any TASO center, a disinformation center, or any ART center. You may not find what we call qualified counselor, but we have peer counselors, people with experiential knowledge. And then also, of course, the normal health worker, they can also do counseling and support you, tell you what to do. This going down, it means more infections are going to happen. Now, you don't see it now until in the future when you see it. Yeah, look at the side of deaths. We have now about, I think the deaths, about the infections are higher, the deaths are about 19 or something like that. That means about 50 people dying every day. That was before. Now, during the lockdown, when the access to healthcare services are limited, you will expect it to go higher. And again, this affects more men. More infections occur among us women, especially young women and adolescent girls. But more deaths occur among men because the poor health-seeking behavior. Yeah. And one of the things, Sophie, which especially prompted me to be open is the issue of men, especially men who, my type, professional people. They know they're HIV positive, but they keep quiet. They even have information on the internet. They have access to Google and can Google anything. They have the information, but they keep quiet until it's too late. Now HIV is like a stone rolling down a hill. When it's up there, you can put a small stone below it. It will stop. For support. But when it has gained momentum, even if you stone it, it will carry you and kill you. And that's exactly what happens. Once you reach a certain point, what we call advanced HIV disease, your CD4 goes below 200. You have the disease like which I mentioned, like cancer. See, many of the cancers are related, not all of them. You have diseases like meningitis, which I mentioned. TB, which is the biggest killer of people living with HIV. Now, all these can be prevented, but how do you prevent them when they have no access to healthcare services? Even some places, you know, even have health workers are not able to work. See, we have had stories of health workers who are brutalized when they are trying to go to work because of other things, or they don't have transport, so they can't work. So this is it, but it's not all lamentation, as I said. Yes, there are successes. By making this kind of noise, letting people know you can call somebody. For example, in every district, we have a district coordinator. Okay. We even have a district chairperson like me, my national. These people, if you call them, they may not know everything, but surely they know somebody who might know somebody
who will be able
to help you. And this is what we encourage people. You don't have to know everything, but know somebody. For example, encourage people that know for example, the number of your district health officer. This is a very important person. Or the number of the person at the health center. Or a number of the ART focal person at the same place where you go. But people, you ask them, me, I don't care for me. They give. No, you need to know them. In fact, know them by name. I often call my doctor. I have a doctor, I don't treat myself. I call him to say, thank you. Why are you calling? Nice. So I just checking on you or send him WhatsApp. That's a relationship building. Because I know one day I might need him. And when I call, he will pick. Yeah. But if you have not prepared where to land, you will land, of course, on stones.
Now, Dr. Atete, from your personal experience, you said you once had COVID-19. That was around December.
Yes.
Now, with the vaccination around, did you get vaccinated?
Yes. I was in Mulago. I was closely behind the minister. I was among the people who got vaccinated on the first day. Yes, I was there, and I posted the picture immediately.
Where did you get the courage from? Because, you know, like, there are lots of myths and misconceptions about vaccination. And then also, like, now imagine somebody's already living positively with HIV, the fear of going to get vaccinated.
Now, look, I'm not fatalistic, but I'm realistic. And I'm not so much a hardcore scientist, if you want, but I like science. I like statistics. They have given me the statistics that if you get this vaccine, actually you may even get COVID, but you will not need intensive care. They even give you some statistics, but there are a few of them, but if you get it, you can get clots. They mentioned that, you remember. But then they mentioned that if you get COVID, you'll get clots. And actually people who get clots when they have COVID are more than those who get clots when they have the what? They have the vaccine. Even people who are on contraceptives are at a higher risk of getting clots than those who get the vaccine.
Yeah, true.
So, indeed, I took a bit of risk. But leadership is about risk-taking. You must lead from the front. So I did. I posted it. People were not happy, including my daughter. Said, "Daddy, why did you do this?" I said, "No, I think I'm safe." It was not very easy. I reacted quite. My body became a bit agitated. But that's a good sign, by the way, because you're introducing a foreign body in your body. So if nothing happens, it means your body maybe is fake. It's like a thief enters your sorry to use the word fake. If a thief enters your house, picks things, and you are sleeping, and nothing happens. You wake up, that means you are not real, you are dead asleep. When you get some reaction, it means the immune system is working. Pain, some fever, I took Panadol. 3 days it went. After 8 weeks, I went back. Actually, the minister told us to wait for 12 weeks, but me, I know, I said, no, I'll go for 8 weeks. I did. After those waited for 12 weeks, actually, the vaccines were finished. Some of them haven't got yet. But anyway, I got both. And again, and I'm here, as you can see, by God's grace. I know some people might have got challenges, but for me, you know me, I'm locally. I pray for my medicine and pray that God, their bad effects, those not happen, let the good effects be the ones that help me. And I thank God so far so good. And I encourage all my friends, please, trust the scientists and do it. If they bring vaccines and you have opportunity to get them, you get, don't fear. Eventually you'll die of something anyway, but don't die of COVID, sure.
Okay, now how can people living with HIV continue to protect themselves against COVID-19? Because for you, I can see you're more of like, how should I say, up speed with, you can even work from home, but still have your work done. You can step out
because when it's necessary.
After that, yes, when it's necessary.
But most of the time, in fact, during the lockdown, what I did, before actually I had made the mind because of the traffic jam in Kampala, I sold my car, converted my garage into an office. I have a home office, and I work from there. But of course, people have to go out, but don't go out unnecessarily. Then when you go out, put on a mask. You hear people saying, I hope you don't have COVID. Oh, let's shake hands. Let's hug. I hope you don't have. Don't hope. This is the same like people who engage in sex and say, I hope you're not positive. Hope you're not positive. Why are you hoping? Find out. Go and test. With COVID, you don't take chances. Wash your hands. And I like when I was entering here, every corner there is sanitizer. Sometimes I feel like I've drunk alcohol so much, I smell like my hands are dry, but that is a small price. Sanitize. Wash hands. Sometimes people I see, when they say wash hands, they put their fingers. That's not washing hands. Wash hands properly. Wash hands and then go. Put on your mask. Put on properly. Cover your nose, your mouth. If you are in a high risk, and I like some young people, they have eye shields. Because as I'm talking, if they have no mask, aerosols, as we call them, can come and land in your eyes. It enters through the main, as you call it, mouth, eyes, nose. So if you have glasses like mine, maybe you're better off, but covers your face, especially if you're in a busy place, you have to keep talking to people. But the mouth, covering the mouth and the nose, especially when you're going out, is the best. Just like we did with condoms. If it is not on, it is not safe. So don't say, I hope, even if it is somebody you know. If we do this, eventually this disease will go. So and for people living with HIV, there are no special things you must do. People say, man, what must we do? Nothing. Just do what everybody is doing. We know that if you are malnourished, the chances of being affected by any disease are higher. It will push you, like squatting. Any small thing will push you down. So make sure you eat a balanced diet if you have. And balanced diet, I mean, eat sausages. Actually, eat. We have a lot of good food here, which has carbohydrates, which has especially proteins and vitamins, and which protect us. But I especially would like to warn, especially young people, the risks you take. For example, you are in a place playing matatu, or I see them playing Ludo, shouting in front of each other, and no masks. Yet when they started, they put their masks on. But after sitting there for 5 minutes, they remove the mask. We saw the same with condoms. First time, use condom. Second time, use condom. Third time, you don't trust me? Really? Just because you've had sex 3 times and I trust you? That's not true.
True. And that is how it has happened.
Yeah, and then you get infected and everybody.
I know, it's terrible. Now, as Nafufano, how are you integrating psychosocial support and, reducing the stigma amongst the people living with HIV/AIDS?
Now, we discovered that stigma is based on myths and misconceptions. When you mention having the HIV, you say, oh, Bambi, that's the first problem I had. As a locally who has HIV, say, hey, Stephen, that means you are not what you say? Or was it your wife? The answer is maybe none of the above. How about children who were born lying peacefully in their mother's womb and then they get infected? How about girls who were raped? Anyway, know the facts. So we try to use media like what you are using now. I write. If you read the New Vision every month, I write. If I get opportunity, for me, even if you invite me to talk about anything like maybe climate, I will sneak in something with HIV. Actually, at the moment, I'm even working on some document, again, maybe for another reason, but to try and encourage, for example, religious leaders, people of faith, that when you get an opportunity, people have come for whatever reason, whether a funeral, a baptism, or Jummah prayers, mainstream a message about HIV. Be wise. Don't use threatening messages. Hey, you are going to die. People don't want to hear that. Everybody's going to have. You ever seen anybody who lived life without dying? So don't dwell on that one. People are going to die anyway. But before they die, we're saying don't have TB, don't have COVID, don't have HIV. And these are the ways you have to prevent it, like we have explained. If you put on your mask, if you wash your hands, if you avoid crowded places, then you will not get COVID. If you get it, call this number. And we have, I think, I don't know whether they gave you a number, I don't have it in my head, a hotline where you can call in Afofano. They don't have all the information, but they know where to get this information.
And where to guide you.
Where to guide you. Personally, I put my number in public domain and I give it each time. People ask me questions. WhatsApp, they call, send me text messages. I may not have the answer, but if somebody calls me, for example, from Zombo, I have never been Zombo, but I know foreign from Zombo, it's a call Ramadan. That's not his name, but let's call him Ramadan. And they call Ramadan, and Ramadan can help. Call in Mbale, I say, call the district health office. I know the DHO of Mbale. During the first lockdown, a lady called me from a place called Masaf. You know where Masaf is? Masaf is in Busia, near the border with Kenya. He said, we came here with my daughter, but she's on ARVs, and she's positive, and she has been pregnant. Now she has delivered here worldwide. We need, they should put a child on a Virapin. So where are you exactly? I said, I'm in Masaf. Do you know where Masaf Health Center is? Yes, it's near here. I can't even walk there. But how they can't? They don't know me, and I can't tell them. I tell them no. Just go there, and I called them out there and said, I explained. Have his number. Explain. And said, a person is going to come, give them the therapy. Explain to them, don't ask them too many questions. Just document that you have given a therapy to somebody, and this is my patient. This is accepted by the ministry because they can reconcile the statistics later, but somebody must be helped. So how have we helped? Networking, which I've encouraged every person to have. In every community, have people who can reach out to you. Of course, now telephone. Luckily, the telephone connectivity in Uganda is quite good. You can call anybody anywhere. At any time. At any time. They have the what. So we lobbied, we got some data. I got some data facilitated, so we can call. My phone, even by as I'm talking, when I go back, there are many missed calls. I call back. I try to call back. And we have what they call salt line at Nafafano. There are counselors, peer counselors and other counselors. If you call on that number, they will answer. We've also used radios to explain that don't suffer alone. If you need help, call somebody to help you. And we appeal to all people living with HIV, the over 1.4 million Ugandans, that please, please, be organized. Let somebody know. Don't go it alone. Even the person you're hiding from might also be hiding from you. True.
It is true. Now, you talked a lot about you mentioned bits in here about some of your partners, one of whom strongly I can see is, of course, by the time the Ministry of Health is in the front line to support, we might need to probe a little bit. I would like to probe a little bit more on how much and to what extent, in terms of, like you said, the support where now all health centers one can get easily the access to the medication. There could be other ways.
Yes, yes. Ministry of Health, you know, works because they're the technical. They're the ones who run these ART centers. But they have what they call implementing partners. You know, you have groups like Mild May. Yes. You have TASO. You have IDI. If you go to the east, there is what they call the USAID project. USAID is a project of PEPFAR. PEPFAR is the President's Emergency Fund for its relief in Africa. You might have heard about it. Yes, I have. It's American people. We thank God for them. They've put there, there's Rights East. There's what they call Rights Lango working in the north. So these people, they have focal persons. Many of them actually even have driven. Sometimes they use borders. See? sometimes we use, like in the morning I was with on another talk show with a colleague called Dr. Muganga from IDI. He said, no. We even packed medicines and put on a police what? Van.
Oh, wow.
Yeah, you tell the policeman, look, you are going to Mukono because I'm not able to go there. A policeman, of course, can go anywhere. When you reach there, call this number. Or there's somebody standing somewhere, you give him this box. We have used, including young men who walked. There was a young man who rode his bicycle until it broke down. I have a friend called Kraish Mubiro. Kraish is a superstar really, in my opinion. If I had medals, I would give him. But what I like him is that without asking, he started driving his car. He managed to get a permit. Sometimes he was arrested. He spent time at police, but he was delivering ARVs for people at homes. God bless him. We have had such people. There are other unsung heroes. Some people do it and they don't want the left hand to know what the right hand has done. Yes, they are there. We really, what we are saying is that each one of us must do something. If you are going to collect medicine, for example, maybe you have a permit, the neighbors, you think you are the only one who has HIV in that neighborhood. So you see, if we formed a neighborhood group, we can even use one of us, maybe a border rider, say, go and collect for all of us. We can even give you all the money you need, because after all, you're going to collect for about 10 people.
Yeah, true.
Yeah. The minister also has what they call also the differentiated service delivery. Now, for example, they say if your viral load is suppressed, they can give medicine for up to 6 months. So you can go to Karamoja and stay there for 6 months. Surely after 6 months, maybe they will have changed. Or there is what they call drug distribution points. They put medicines at a pharmacy where you must go to collect medicine for other things. You can go and pick your ARVs from there because there is an understanding between the pharmacy and the implementing partner and other places like that. So we do that. There is something for somebody. That's what we would like. We would not like to leave anybody behind. We would not like to leave anybody behind. Every person who is on ARVs must be supported socially. Even if they're doing well, the viral load suppressed, we must check. Some people get depressed. You see? I always remember a story of a teacher in one district too, who was doing very well, was one of the best primary teachers. His viral load was very suppressed, but he got depressed.
Oh dear.
So when he went and collected his ARVs, he passed by a shop, bought warrage, and swallowed all the ARVs for 3 months using a bottle of warrage. The note he left is that life is not worth living. That is extreme depression. Now, he needed somebody to tell him, look, life, you are the best teacher here. All of us would like to be affirmed. You are smart. Oh, you are loved. You know, we would want to hear these things. So this is what Afano does. We call, we say it, we act it. We may have not done so much, but this is our vision, where every person living with HIV is supported. And that's why we encourage all people living with HIV to register with these networks. They have weaknesses, but which organization does not have weaknesses?
It is true.
Yes.
Now, what advice do you give to people who are worried that they could have been exposed to HIV during this period of COVID-19?
Well, any person who suspects may have been exposed, and normally these are sexual exposures, or along in line of duty, some of us, because maybe you are helping somebody. Again, call a number like the number we are going to give you, I think the phone number. Even my number, I give it out. Maybe possibly before I finish, I'll give it out. If you call me, I may not know you, and I tell you, don't have to tell me your name. Ask you, where are you? And if you tell me, for example, I've been in Mukono, I'll tell you, you go to Mukono Health Center 4. There's a hospital there. Or they call it Namirembe, the other one over there. They are there. Or say, I know I fear I leave this side. Say, no. Sometimes I drive there myself, or I ask some of the young people. We have the young people say, we help you. We do. Because you must be, for example, if you are exposed, you must be tested. And then if you are found negative, you should be put on PEP, post-exposure prophylaxis. PEP is not medicine, but it's a practice of giving ARVs to somebody who has been exposed to HIV. Yeah. Don't just say how I fear.
Now that you've even mentioned the PEP, you know, let me use the realistic situation of with COVID-19. The first time we heard about it, everybody started now, once they knew the drug regimen that is being used elsewhere,
yes,
the drugs it's not even off-the-counter drugs, but people just somehow...
They even use dexamethasone.
Yes, and will have them in their houses. They stock up of all these drugs. They went and bought
chloroquine. Let me tell you this. Self-medication is a killer. Do not treat yourself, even if you're a doctor. Even at home, I don't treat my wife. I have a small clinic nearby. If my wife complains, we go there together with her and ask this young man to help us. The only medicines I have at home are ARVs, because that's what I swallow every day. But what we do, what to avoid to do is to medicate yourself. Now, COVID, everybody became a power.
And the herbalist.
Herbalists. Before COVID came, people prescribing everything. But now COVID has joined it. Swallow everything. Some of them started slashing. The other found they slashing my hedge. When I happened, when I said that we're going to boil and Kweyo Teresa, whatever to call it. So this is not good. This is anarchy. That's called anarchy. We have a Minister of Health here. They give guidelines. And why do they give guidelines? Because the President has picked the Minister of Health, and the Minister of Health is supported by very highly trained technical people who are connected to what they call the World Health Organization, which gives guidelines. Guidelines are like telling you, you drive on this side. You see? If you don't, then we shall have an accident. So don't swallow medicine. Give yourself first aid is good. If you have a fever, you can swallow Panadol. But if symptoms persist, even the advert for Panadol says seek
medical advice.
So if symptoms persist, then you swallow dexamethasone. Dexamethasone is used by doctors in specialized units. Unfortunately, now you can buy it for both all sorts of things. This is not good. Some of them may have died. Some may have recovered, but you don't know the damage done to the liver, the long-term effect. In the future, you'll say, oh, so-and-so died of liver. It could be the what? This one. Yeah.
So, Doctor, I would beg you to share with us.
The numbers you can call in case you want more guidance, information, or counseling. Counseling means you say, I don't know what to do, like you have said, you have been exposed. You can call this number, 256 200 94 44 98. Let me repeat. Plus 256 or 256, yeah? 200 94 44 44. Or you can call 0701 4444 5 times 8. Or you can call a toll-free number. This number, there is somebody there. If you call those ones above, they will charge you. But if you call a toll-free number 0800 100 330. Let me also give you my number, because many people say, we want call it. But when I call you, call me, they remind you of this number actually. It's 0700 180 114 or 0772 63 8466. I repeat that one because it's also my WhatsApp number, 0772 63 8466. The national network also has a website. You can go to the website www.nafofano.org. You may find some information there, including these numbers. But for God's sake, do not suffer alone. Do not let any person suffer. Even if you suspect somebody is suffering, help me, help us. We respond. Let me finish with this interesting story about a friend of mine who called me.
In a minute, doctor.
Yes, she told me there was a lady who was dying of hunger with 2 children because she has no food and she needs ARVs. So I said, okay, how do I help? So she sent me the photo of the children, of the ARVs. I took, went somewhere. When I was reaching, when I called where we were, she said, no, you go somewhere else. I went because she didn't want me to go. Then when she came, I said, this is great. Then she said, we have bought one for another month. I said, yeah, this is what I could. But then, to cut the long story short, ask her, what is motivating you to help this old lady? She said, look, for me, I have lost so many of my relatives, so I don't want this woman to die. I said, oh, that's so I told her what motivates me. I told her what I've told you. For me, I suffered from HIV, and God helped me, so that's why I'm also motivated to help others. She started crying. So, why are you crying? I said, no, the woman is not there, I'm the one. So please, when somebody calls, go there. It may not be this kind of, may not be what this, but go there. Or if you can't go, call that number, or call me, or call somebody else. Thank you.
Okay, thank you so much, Dr. Watiti. I'm sure you've heard it all. I don't think I need to add anything more, and would like to say that let's follow the Ministry of Health SOPs that have been put in place, and let us stay safe. We must wear a mask like we have been advised. We must wash our hands, and only move if you must move. There is no point as to why.
Also have enough air.
It is intellectually engaging.
And you can only become a leader when there are problems.
I like that.
The same applies to Rwanda, Burundi. So what are we federating?
Whether rats from another country can be, I mean, somebody must be there to hold everybody accountable.
But at the moment, we would rather deal with what we have, make it right.
First of all, we as elites of Uganda we have made Museveni the issue. I can tell Museveni is not the problem of Uganda. The problems of Uganda are much deeper. We can change the next 20 presidents and we'll still be this roundabout.
Deeply incisive.
The different political forces that we have in the country, in the country, we don't seem to really have achieved that minimum political consensus over certain things.
Authentically symbolic and insightful. Behind the Headlines, every Wednesday at 10 p.m. with Charles Odong Thor. All on your public broadcaster, UBC, inspiring Uganda.
Blood is needed every 2 seconds. About 1 out of 7 people entering a hospital need blood. Blood donations are more necessary than ever during the current COVID-19 pandemic. And the safest blood comes through voluntary unpaid donation from people like you and me. Uganda Broadcasting Corporation, in conjunction with the Uganda Blood Bank, invites members of the public to join its staff on 19th and 20th August 2021 in the UBC Gardens as they donate blood to save lives. All standard operating procedures will be followed during the exercise. Since blood cannot be manufactured, excuses never save a life, but blood donation can.